Greetings. Today's topic of lecture is panic disorder. Let us first understand what is a panic attack. Panic attack is an abrupt surge of intense fear or discomfort which reaches a peak within minutes, during which a variety of psychological as well as physical symptoms can occur. A panic attack is very much different from a panic disorder, and we will understand how in the later slides. But it is very important for us to first understand of how a panic attack feels like. It is a very unexpected fear and discomfort, and it can last for some minutes. There are lots of physical and psychological changes which can occur in our body. So, what are the symptoms that occurs? We have rapid heart rate, sweating, shaking, shortness of breath, hot flashes, lightheadedness, impending sense of doom, chills, nausea, abdominal pain, chest pain, headache, numbness, tingling. A lot of this combined physiological and psychological symptoms are being experienced by the people with panic attacks. And uh, panic attacks can be experienced by someone in one's lifetime, but panic disorders, it needs to meet certain criteria for it to be diagnosed for a person. Now, panic coming to panic disorder, the diagnosis is given to the people who experience recurrent unexpected panic attacks. So recurrent, it happens more than once, and unexpected, it's nobody expects, it happens out of the blue. And that is a very important diagnostic criteria when you have to when you are seeing the patients who come to your clinic, who is a patient who is experiencing panic attacks, and who is a patient who is experiencing a panic disorder. If the patient is experiencing a panic disorder, that means that he or she would have a lot of attacks in a single day or in a week, which requires further psychiatric as well as clinical psychology interventions. Now, based on DSM-5 criteria, we the symptoms of panic disorder are as follows. And if you see the physical symptoms, it includes palpitations, heart rate increases, trembling of the body, shortness of breath. You get a feeling of choking, like something is stuck on your throat, and you feel it that it's something physiological, but it's not really physiological, it is a symptom of the panic attack. And your chest will feel really tight during a panic attack. You would start to feel even dizzy, and your head would go round. You would feel very lightheaded during this time. And psychological symptoms, your cognitions would be on the run, and it will say that I'm going to die, and you will have intense fear of losing control and going crazy, an impending sense of doom, and you would feel that you are being detached from your own body and surroundings. So there is a lot of psychological symptoms that is being experienced by someone with a panic disorder. An important question that you can ask right now is how long does a panic attack last? So usually it reaches a peak within 10 minutes, and then the symptoms begin to subside, but it could even last for an hour. And most panic attacks, most, okay, it's not the norm for most people, most of these attacks, they last for about 20 to 30 minutes. Now, an important question that the clients with a panic disorder or a panic attack can ask you is, can I die from a panic attack? The answer is no, because it is also psychological as much as you are experiencing the physiological symptoms. However, if the client has a history, a chronic history of panic attacks, and panic disorder, it is worthwhile for the client to go for a routine physiological checkup with their doctor and check if their physiological organs and all of it is functioning properly or not. And based on that, if there are any abnormalities, they can suggest further investigations for the client. And if it is a client with a panic disorder, they would be requiring both medications as well as psychotherapy. Along with this, it is also very it is also very recommended that you provide the suggestion for the client to even go for a routine physiological checkup to check if his heart is functioning all right. Because what happens during a panic attack is you have a high and intense anxiety which brings up your heart rate. And what did we learn in the previous classes is that increased heart rate, the increase releases a lot of cortisol in the body, and so your respiratory shoots up, then your circulatory system increases, the circulatory functioning increases. So all of it increasing would lead to eventual wearing and tearing of the body in the long run. So you will reach a point where the body is no longer functioning well or has no further resources to function. So with this, I would like to end the class. And today's exercise is to go back into YouTube and study about what the generalized sorry. So you have to go to the YouTube and you have to um, search for the general adaptation syndrome model and get back to me on the next class on what this model talks about. So we will really understand of how anxiety can affect the physiological health of a person. And as clinical psychology students, it's very much essential for you to know this model. Thank you, and I hope to see you all in the next class.